Morning everybody, I'm Sheila Wilkinson, who's the Patient Experience of Care Manager for the Trust. My presentation this morning is about the Trust's virtual visiting service within the Support for Caregivers, Friends and Family Award category. Next slide please. Manchester University NHS Foundation Trust is one of the largest trusts in the country, employing over 27,000 staff. We provide clinical services in 10 hospitals across 7 different sites and community services across the city. These clinical services range from comprehensive local healthcare through to highly specialised regional and national specialities. MFT is the Regional Trauma Centre for the North West of England. Next slide, please. The start, March 2020. At the start of the pandemic, with national requirements to stay at home, MFT, like many trusts, made changes to the visiting policy. Our changes included no visitors permitted to any adult wards, no children than if they were patients permitted, one birth partner only, and one named visitor per patient allowed in paediatric, maternity wards and the neonatal units. Recognising the importance for patients and families and carers to maintain contact and to help patients reach out to their loved ones, the Trust established the Family Liaison Team. This team consisted of redeployed colleagues from dental services and admin roles within the Trust and was overseen by the corporate lead nurse and matron. To set up, COVID-19 safe working practice assessments were completed, role profiles developed, and the SOP was put together. These were all developed, and the staff at the same time received the Trust training specifically developed for redeployed non-clinical staff and dental nurses. A dedicated phone line was established, and the Trust communications team assisted with publicity. Once launched, the Family Liaison Team service operated from 10 in the morning to late at night, 7 days a week, with additional out of hours of visiting arranged if required. The service was available to all inpatients in adult wards in the hospital, and a morning daily huddle was introduced to support effective communication and coordination of the service. The service immediately allowed nurses and medical teams to focus on patient care, while the Family Liaison Team kept families connected through phone calls, exchange of belongings, messages to loved ones, a newspaper delivery service, inspirational quotes to reassure patients, and provided large print crosswords for those that were visually impaired. In April, a kind donation of Lenovo tablets enabled the FLT to expand the service to include virtual visiting calls. Next slide, please. From the start, weekly activity was collected to further understand the needs of the service and how it could be developed. Table 1 provides a snapshot of data collected for the week of the 8th of June, and as you can see, the greatest demand was for virtual visiting. And between April to July last year, over nearly 2,500 virtual visiting calls were facilitated. Next slide, please. Qualitative feedback provided through the Trust's What Matters to Me patient experience framework is included on this page, but I would also like to include what the FLT had to say about their role in their own words. You get talking to patients and you'd phone family for them. As the pandemic progressed, you were doing end-of-life calls and videos for the patient's family who were desperate to see them. It was very, very upsetting. You'd make the call to the family on the iPad and you'd see all the family gathered together to say their last words. You knew it would be in the next hour that they may pass away. It was heartbreaking. A lot of families would ask you to hold their loved one's hand. They knew their loved one had someone with them, and you knew that they were comforted by that. Back in the office, we would unburden things because we knew we had to do the same thing the next day. And I have to say at this point that chaplaincy and the Employee and Health and Wellbeing Service were excellent, providing debriefing and emotional support. Next slide, please. In July 2020, the FLT colleagues started to return to their substantive roles. With a desire to continue to improve compassionate care, plans were put in place to continue with the virtual visiting service. The service will be maintained with the support from PALS, the patient experience team, and volunteers. Learning from earlier feedback was reflected in this new service. For example, the greatest demand for calls was between 12 and 4. Role profiles were updated, and so was the SOP to reflect patient and family feedback. Next slide, please. Over the 2020 festive period, the 12 days of Christmas virtual visiting A Gift to You was scheduled. These calls mainly supported international virtual visiting, in some cases connecting relatives from several parts of the world all on one call. Such calls would have been very time consuming for nursing teams to facilitate. Next slide, please. Further evaluation to users of the service in February 21 highlighted 88% of calls were for patients over 60 and 40% of calls were for those patients who had a visual impairment or disability. Learning from this feedback enabled the team to purchase large screen lightweight iPads, selfie sticks and tripods. Next slide, please. Overall learning and where we are now. IT kit. You need to invest in reliable, robust electronic devices that are lightweight, large screen and easy to clean. And a dedicated phone line is efficient to ensure an accurate booking system. The call. Governance. You need to use a secure application endorsed by the organisation. In our case, it was Accurex. Robust guidance to support the electronic use of devices at ward level, patient consent for the call, and ensuring that the angle of the device during the call maintains patient confidentiality. We checked ahead to make sure that the call could go ahead because of patient treatment as calls are booked in advance, and step-by-step guides were produced to help relatives download the application of Accurex. The team operating the service through a multidisciplinary team enables colleagues to step in for the calls if they were unavailable. This proved particularly beneficial when COVID-19 rates in Greater Manchester increased significantly during the early part of 21. Buddying up new volunteers to keep the service going and a constant chaplaincy debrief and support. Where are we now? Since August 2020, 31 volunteers have helped facilitate over 1,600 calls. We have a cohort of 9 volunteers now doing virtual visiting, and virtual visiting is referenced in the MFT interim COVID-19 visiting policy. Next step. Communications will continue through the lifetime of the project through social media. Information about the service is available on the COVID-19 Internet Resource Area and the Trust website, and more recently during National Volunteers Week. Recent family requests purchased more iPads, the volunteer services strategy, and with the acquisition of North Manchester at the beginning of the year, we're going to be refreshing our impact quality assessment. We're also hoping to run the service in Christmas this year. Finally, before questions, I would like to end with this relative feedback, which I think sums up the whole service and why we do what we do. I would just like to say that these volunteers are a lifeline for families like ours. I live in Canada, and this was the only way I was able to see and speak to my beloved mum before she died. I will be forever grateful for this. Thank you so much from the bottom of my heart.